After 60, your body doesn't always speak loudly. It doesn't cry out with flashing signs. Instead, it whispers, softly, subtly, through things you barely notice, like your breath, like your skin, and sometimes like your tongue. Most of us never think to look at it. We brush our teeth, rinse, move on with our day. But your tongue, this small, soft part of your body, has been quietly showing you signs all along. A change in color, a new crack, a strange coating, a sense of dryness or burning, even a shift in shape. These might seem small, but they can tell deeper stories. Stories about what's happening in your blood, your digestion, your immune system, and even your heart. And the best part? You don't need a lab. You just need a mirror and a moment of attention. In this video, we're going to take a slow, close look at your tongue. Not to scare you, but to empower you. Because the truth is, your tongue has been talking for years. It's time you learn to listen. Let's explore what your body might be trying to tell you, quietly, gently, and honestly, starting with something as simple as the tip of your tongue. A dry or cracked tongue can reflect dehydration or kidney stress, something many seniors experience without knowing it. Nutritional status. A smooth, red, or burning tongue may be your first sign of B vitamin or iron deficiency, especially if you don't eat as much or absorb nutrients well. You can check your tongue any day at any age in your own mirror. It costs nothing. It takes less than 30 seconds, and it teaches you to be present with your body, even in the smallest ways. In fact, developing the habit of checking your tongue in the morning is one of the most underrated self-care practices after 60. Because it's not about fear, it's about familiarity, learning what's normal for you so that if something changes, you notice early and respond gently. Think of your tongue like a whisper. It doesn't scream, it doesn't demand, it just shows. And as you grow older, your body becomes more honest in subtle ways. Not to scare you, but to invite you into a deeper partnership with your health. The more you notice the quiet, the more you protect your peace. And your tongue is one of the quietest, clearest places to start listening. Part 2, 6 warning signs to watch for on your tongue. What this small muscle can tell you about your body. After 60, your tongue is like a window into your internal health. And as you age, its surface can quietly reveal early signs of things that might not show up in blood tests right away. Let's explore 6 of the most common signs seniors should look for when examining their tongue and what they might mean. 1. Pale or light-colored tongue. A healthy tongue typically has a soft pink color, but when it turns pale, it could suggest anemia, iron or B12 deficiency, poor circulation, or low oxygen in the blood. Many older adults develop anemia without realizing it, especially those who have reduced appetite or digestive issues. What to do? Ask your doctor for a blood test to check iron, B12, and red blood cell levels. Consider adding iron-rich foods or supplements if advised. 2. Bright red or beefy tongue. A tongue that's overly red and smooth, sometimes called beefy in appearance, may indicate vitamin B12 or folate deficiency, inflammation in the digestive tract, infections, or immune response. This is often accompanied by burning or tingling sensations, especially on the tip and sides of the tongue. What to do? Increase your intake of leafy greens, B-complex vitamins, and speak to a doctor about possible malabsorption issues. 3. White coating or patches. A light white coating is often normal in the morning and may disappear after brushing, but if it stays thick or looks like patchy, fuzzy areas, it may be oral thrush, fungal infection, especially common if you wear dentures or take antibiotics, weak immune function, excess candida or gut imbalance. In some cases, a white coating also reflects sluggish digestion or toxin buildup. What to do? Use a tongue scraper daily, reduce sugar and processed foods, seek antifungal treatment if thrush is diagnosed. 4. Cracks or fissures. Some grooves in the tongue appear naturally with age and may not be serious, but deeper, sudden, or painful fissures could signal chronic dehydration, vitamin B deficiencies, excess heat in the body, according to traditional medicine. Sometimes these cracks can collect food particles and lead to infection if not cleaned gently. What to do? Drink more water throughout the day. Improve oral hygiene. Consult a doctor if cracks are painful or bleeding. 5. Smooth, glossy tongue, atrophic glossitis. This occurs when the surface of the tongue loses its tiny papillae, becoming overly smooth, thin, and shiny. It often results from long-term B12 or iron deficiency, nerve damage, autoimmune conditions, digestive absorption problems. Many seniors with undiagnosed stomach issues or poor diets experience this sign without realizing it's linked to deeper problems. What to do? Test B12, iron, and folate levels. Consider digestive support and nutritional adjustments. 6. Purple or bluish tongue. This is a more serious sign that may reflect poor blood flow, low oxygen levels, heart or lung strain, cold hands and feet, fatigue or shortness of breath. A tongue that looks purplish, especially at the edges or under the tongue, is often linked to circulatory stagnation, meaning your blood isn't moving efficiently. What to do? Check blood pressure, heart health, and oxygen levels. Walking, breathing exercises, and circulation boosting foods may help, but consult your doctor first. Seeing a change in your tongue doesn't mean something is seriously wrong, but it's your body's way of gently asking, can you look a little closer? Can we catch this early? Can we prevent something bigger from developing? When you become familiar with your own tongue's normal appearance, you'll be better able to spot when something is off and take action with calm, clarity, and care. Part 3. How to check your tongue at home and what to do next. A simple 30-second habit that can reveal more than you think. You don't need to be a doctor. You don't need fancy equipment. You just need a mirror, some good light, and a few quiet seconds each morning. Checking your tongue is one of the easiest and most underrated health habits, especially after 60. It's simple, free, and gives you early insight into your internal well-being. Let's walk through how to do it properly and what to notice. Step 1. Check first thing in the morning. Your tongue offers the clearest health clues before eating, brushing, or drinking anything. Why? Because overnight your body processes waste and detoxifies through breath and saliva. The tongue collects those changes and displays them clearly before you rinse them away. Best time, right after waking, before breakfast, or brushing teeth. Step 2. Use a natural light source and a plain mirror stand near a window if possible. Natural sunlight shows the true color and texture better than artificial bathroom lights. Gently open your mouth and stick your tongue out in a relaxed, natural way. Try not to tense or stretch it too hard. Let it rest on your lower lip so you see its true shape and coating. Step 3. What to look for. Checklist. Use this simple checklist to observe the following features. Color. Pale, red, purple, consistent throughout, or blotchy. Coating. Thin white, normal, thick, yellowish, patchy. Moisture. Dry and sticky, overly wet or foamy. Texture. Smooth or rough. Are there papillae, tiny bumps? Cracks or lines? Are they shallow or deep? Are they new or increasing? Swelling. Does the tongue look puffy or pressed against the teeth? Sensation. Burning, numbness, or tingling? You don't have to memorize everything. Just get familiar with what's normal for you. That way, any changes become easier to notice. Step 4. Keep a simple tongue journal. Every few days, write a short note. Tongue pink, thin white coating, normal. Noticed cracks deeper than last week, feels dry in the morning despite drinking water. Why journal? Because patterns matter more than one-time changes. You might forget subtle differences, but a simple note helps you track your body's signals over time. The tongue changes slowly. Journaling helps you notice early before symptoms grow louder. See your doctor or dentist if you notice any sudden or persistent change lasting more than 10 days, a sore lesion or patch that doesn't heal, burning or numbness with no known cause, a new color, purple, bright red, or very pale, that doesn't fade. Even if it's nothing serious, getting checked gives peace of mind and may catch something early that's still easy to fix. If you're curious about something you saw, try these before rushing to worry. Drink more water and recheck in 2 days, reduce sugar and acidic foods for a week, take a short walk daily to improve circulation, add more leafy greens, protein, and B vitamins to meals. Use a tongue scraper, gently, once each morning. These small acts often improve tongue health naturally because your tongue responds quickly to better habits. After 60, the smartest thing you can do isn't chasing new medications or worrying over small aches. Sometimes it's simply slowing down and listening to your breath, your skin, your movement, and yes, your tongue. Because your tongue is a mirror. It reflects not just what's wrong, but what can still be supported. And healing often starts not with a pill, but with attention. Part 4. Gentle daily habits to support tongue and overall health. Simple steps to keep your tongue and body clear, clean, and connected. Now that you know your tongue is more than just a surface, that it reflects your inner systems like circulation, digestion, and immunity, you might be wondering, what can I do each day to take care of it? You don't need an expensive routine. You just need a few gentle, consistent habits that support your whole body from the inside out. Because when your inner health improves, your tongue reflects that light. Let's explore some simple habits that keep your tongue and your entire system strong and clear, especially after 60. 1. Hydrate properly throughout the day. Why it matters. A dry, cracked, or sticky tongue is often a quiet sign of dehydration, something common in seniors even when you don't feel thirsty. Proper hydration supports saliva production, protects the tongue and digestion, kidney and liver detox, circulation and oxygenation, prevention of white or thick tongue coating. How to do it. Start your morning with a glass of warm water. Optional, add lemon or a pinch of sea salt. Sip water regularly, not all at once. Reduce caffeine and alcohol, which can dry the mouth. Add soups, herbal teas, and water rich fruits like cucumber or watermelon. A well hydrated tongue is a clear, soft, pink tongue. 2. Clean your tongue gently each morning. Why it matters. Bacteria and toxins build up overnight on your tongue's surface. If not removed, they can lead to bad breath, oral imbalance, and even digestive strain. How to do it. Use a soft tongue scraper or your toothbrush without toothpaste. Gently scrape from back to front 3 to 5 times. Rinse your mouth with warm water afterward. Avoid over scrubbing or using harsh pressure. This simple habit helps reduce white coating, improve taste sensitivity, prevent oral infections. Tongue cleaning is like clearing your windshield each morning so your body can start the day fresh. 3. Support nutrient absorption with a balanced diet. Why it matters. Many tongue changes, pale, smooth, red, or burning, are early signs of nutrient deficiencies, especially iron, vitamin B12, folate, zinc. As we age, we absorb less, even if we eat well, and some seniors eat less than they used to, making nutrient needs harder to meet. How to support it. Include dark leafy greens, beans, eggs, fish, and lean meats. Consider a B complex vitamin or iron supplement after consulting your doctor. Eat slowly and chew thoroughly. Digestion starts in the mouth. If you wear dentures or have chewing issues, try soft, nutrient rich options like stewed vegetables, lentil soup, or smoothies. What shows up on your tongue often starts with what's missing in your plate. 4. Improve circulation with gentle movement. Why it matters. A purplish, swollen, or bluish tongue may reflect sluggish circulation or oxygenation, especially in older adults with slower heart or lung function. Simple movement helps. Deliver oxygen and nutrients to the tongue and entire body. Improve blood flow to the head and face. Support tongue color, energy, and brain clarity. How to do it. Take a 15-minute walk daily. Practice slow neck rolls or gentle yoga. Do deep breathing. Inhale for 4 seconds. Exhale for 6 seconds. Avoid sitting in one position too long. Every step you take sends fresh life to your cells, and your tongue thanks you for it. 5. Maintain healthy oral hygiene and mouth breathing awareness. Why it matters. Mouth breathing, especially at night, dries out the tongue and throat, affecting saliva flow and tongue texture. How to support it. Breathe through your nose as much as possible. Treat any nasal congestion gently. Use a humidifier at night if your home is dry. Brush and floss daily. Visit your dentist every 6 to 12 months. If you wear dentures, be sure to clean them thoroughly to prevent fungal buildup that can appear on your tongue. Many traditional healing systems believe the tongue is also tied to emotional expression, especially when we hold back feelings, suppress grief, or live in long-term stress. Some seniors experience burning or numbness in the tongue, not from physical causes, but from stored emotional tension. Try speaking gently when needed, journaling your feelings, practicing gratitude or prayer, letting silence soothe you instead of swallowing your emotions. Your tongue doesn't just reflect the body, it reflects the soul. You don't need to do everything at once. Just begin with a glass of warm water, a gentle tongue check, one nourishing meal, a walk in fresh air. And slowly, your tongue will begin to shift, not just in appearance, but in what it reflects back to you. I'm listening. I'm healing. I'm finally being cared for. At this stage in life, the body doesn't shout, it doesn't demand, it simply begins to whisper. A little dryness, a shift in color, a strange sensation that's easy to dismiss. And often it's your tongue quietly asking, will you look closer? Will you care before the symptoms grow louder? Will you listen to the part of you that's been showing up every day without complaint? You don't need to fear what your tongue reveals. You only need to be curious, compassionate, and consistent because this small muscle in your mouth, it holds decades of memory. It carries your words, your nourishment, your breath, your truth, and now it gently asks you to pay attention, not with worry, but with respect. Don't wait until something is serious. Don't overlook what your body is trying to say. And don't ever believe that health must be complicated. Sometimes the path back to wellness starts with a mirror, a quiet moment, a gentle, that looks different. And from there, healing begins. You don't need a diagnosis to start caring. You only need awareness, and your tongue is a perfect place to start. If this helped you notice your health more gently, like this video if you learned something new about your own body. Share it with a friend who's never checked their tongue before. Subscribe to True Senior Wisdom for weekly guidance on gentle aging, quiet healing, and daily awareness. You've spoken your whole life. Now let your tongue speak for you, not through words, but through quiet signs of truth and balance. You're not too late. You're right on time. And your body still wants to work with you if you're ready to listen.